Hi, I'm Randy Alvarez. You're watching the Wellness Hour, news that makes you healthier. In studio, we have Dr. Manchikanti. We've had him on the program before. He is the chairman of the American Society of Interventional Pain Management Physicians. Dr. Manchikanti, welcome to the program.
Thank you, Randy. It is American Society of Interventional Pain Physicians.
Okay, good. Now, I'm going to ask you a lot about that, but you actually founded this society many years ago. You have your own Wikipedia page. And a lot of people don't know, and I learned this from interviewing you, that interventional pain management, your sole purpose, or one, I don't want to put words in your mouth, is to treat pain, people that are in pain, without medications. Is that correct?
Or with as little medication as possible.
Okay, good. So let's start right off the bat, because we had a conversation the other day about this hydroxychloroquine, and you know a few things about it. You said in India, they've been using it for malaria. Tell me a little bit about that drug and how it the promises for the treatment of the coronavirus.
Hydroxychloroquine is also called Plaquenil. In United States, they also use it for various other drugs like rheumatoid arthritis, lupus. So it has been around for a long, long time. Like I went to medical school in the late 60s. At that time, part of our duties or jobs were as medical students to travel to these remote areas and give each person 2 tablets of that so they can take it to prevent malaria. Over the years, it has worked very well. They're not doing that any longer in India. So it is a very safe drug. So when this started happening, they noticed that people who have taken this drug was not getting as frequently as others the COVID-19 or coronavirus. That is one of the reasons they say in South Africa it is much lower. The same thing goes for Indians.
Because they're taking this drug right now for prevention and treatment?
No, they were taking it for malaria.
Okay.
And they give it as a prevention of malaria. So that is also preventing. This was an accidental finding. It has anti-inflammatory effect. So they thought that it would work. In COVID-19, the main problem is the inflammatory components. It is like a storm, a terrorist attack. So this prevents that. So we started looking at it. I was writing an article actually on stem cells in COVID-19. I was talking to one of my friends from India. He said, do you know that we are still using that here for that? So immediately I went into research, looked at the various publications on it. I found a publication where it was recommended either chloroquine or hydroxychloroquine. So immediately I reported to my membership about it. Within few days, we found an article coming out of China, then one from Italy, all of them showing effectiveness. And in India, they started giving it as prophylactic. Initially, it was not recommended for prophylactic, but then they started doing it for all frontline workers, people who are essential workers. They still have to work in spite of lockdown. So all of them are receiving them as prophylactic. So that is when I started looking at it. Now, there are 2 studies going on in the United States, one in New York and one in Cleveland Clinic, I believe. So, are one of the other centers, but they're enrolling large number of population people into it. Personally, I have given it to some patients and they are doing very well. I have taken it myself. Now, the question comes is, do you have this strong evidence? We don't have strong evidence for that. Or for many of the treatments we give, like 70% or 80% of the treatments we give do not have strong evidence. So we go up what is called observational studies. They're not randomized double-blind controlled trials. So people don't think that there is a level 1 evidence or strong evidence. Everything else, some call it as anecdotal. That is what Dr. Fauci calls it. I really respect him a lot, but that is the word he used the other day.
Do you agree with that description that Dr. Fauci is using?
No, I don't think so. It is not anecdotal. It is reported in patients and taking in a very strict sense that could be said anecdotal, but I've been arguing against that word in evidence synthesis for last 25 years, ever since I have been doing the research on looking at evidence. But in the United States, what is called is, even if a drug is not approved for things, a physician and patient together can decide to take that drug. That is called a shared decision making. It is called off-label use. 30% of the prescriptions in the United States are off-label.
Okay.
So there is nothing unusual about it. And President Trump supported it, and even Mario Cuomo supported it. There is a Republican, there is a Democrat, and people are giving big flack to Trump, but not to Cuomo.
Well, let me ask you, if you personally, okay, we're worried about getting it. Well, we're all worried about, getting it. But if a family member had it, a friend had it, would you recommend that they get on as part of, everything else you're supposed to do to give this drug?
Yes, sir. I have taken it myself, and I have given it to at least 5 of my friends who had a problem, potentially we couldn't get them tested. They had all the symptoms of it. We quarantined and give them the treatment. And there are several people who have received it. I'm recommending it myself, but I'm not an infectious disease doctor, but it is pretty hard to find a doctor nowadays. And then it is also hard to find this medicine any longer in the shelves. They have restrictions, like unless somebody has symptoms, they won't give it.
But if somebody has symptoms, or if they've tested positive, could they ask their primary care physician, the emergency room physician, to prescribe this? And is it even available?
Oh, yes, it is available. And that is how Trump is getting all the flack about it, because he is making sure that they will supply it. And the company which makes it, I forgot the name of it, but they are going to give so many free doses, millions and millions of it. And they're also working at an IV formulation, intravenous formulation. And they also donated, I think, $20 billion or so to treat this problem, manage the problem. And they make a lot of these in India because of the malaria. So government actually confiscated or took over all the stock and kept them. They may give us some if we need to, but as it is, I think there is 29 million doses available in the United States, according to the press conference the other day.
What do you think, or what do you foresee in the near future? Do you think there are people in the know maybe taking this for prevention?
Yes, a lot of them are taking it for prevention. So if they have it available, and if they took it, like I took it beforehand, and I still have a dose available for me, for my whole family, and few of my friends. And I actually gave to all my employees if they wanted it. So they all have one dose available.
Now this, I'm probably watching the same news you are. They're saying, well, it's not proven, it's risky, there's lots of side effects. And look, working together with the American Academy of Anti-Aging Medicine and Integrative Medicine and Functional Medicine, but there are many off-label uses of things that are very effective. So if we sit around waiting for the FDA to finally approve it, we may never get it freely, right?
That is exactly what Dr. Hahn said. He's the FDA commissioner. He said that is, as a FDA commissioner, I may not approve it and we may not approve it, but when I'm sitting with a patient, I put a doctor hat. It becomes totally a different issue. If patient wants it and if I'm comfortable giving it, I will. On the other comment about lot of side effects, we really don't see that many side effects. Most of the problem is in high doses, long term, you can have retinal detachment. It is very rare. Whereas there is also a myocardial infarction. Other day we were conducting a webinar. I had an infectious diseases specialist speak on our webinar. And he was mentioning myocardial infarction. All this time, it didn't even strike me that that can cause problems with the conduction. If somebody already has heart conduction problem or ST segment elevation, so this can exacerbate that problem. But that is very, very rare.
But that's
Especially for
long-term use. Is this something that you would only take for 2 weeks?
oh, actually, hydroxychloroquine, the recommended dose is it is 800 milligrams on day one. That is 400 milligrams twice a day. After that, 200 milligrams twice a day for 4 days. It is only 5 days.
Okay.
Whereas in India, what they are doing is they give you first day for prophylaxis purposes, 200 milligrams. That's it, not 800 like we are taking here. And then they are giving 100 milligrams per day. I don't know whether they are trying to conserve or not, but the government regulations, Indian government, I think one of my friends was telling, I didn't check that for myself, but their regulations are 200 milligrams like here, twice a day for 4 days, and first day it is 200 milligrams, 2 tablets twice a day.
Because look, I'm watching a lot of news as well. I always hear about the side effects. I don't hear what they are. You're the first one I've heard that even talked about what they are, those two main side effects. But in the literature that you're reading, is it from long-term use you get the side effects, or these mega doses you get those side effects, or like you said, people already with heart problems, etc., will get these side effects? For the average person, you don't see a 5-day, taking it for 5 days as an issue at all.
Not at all. All my experience when I was in India, we were giving to so many people. I never saw a single patient who had a problem. Well, I spent in India throughout my medical school and I did the post-graduation. I was almost 10 years in medicine there. I never saw a single patient who developed any problems. Here also, in the study they reported from Italy, they didn't report a single side effect. 2 studies from China, they did not report any side effects. So,
what is your hunch then, Dr. Manchikanti? Why the big caution of like, well, hey, the president might be wrong. He's not a medical doctor. I don't want to get political on this, but I just want to say, what's your hunch?
Oh, my hunch is most of it is anti-Trump. So never Trump, anti-Trump, left wing. So it is totally political. If you ask doctors, thus far, only one doctor mentioned me these complications, these side effects. We have to watch for the side effects. Until then, nobody ever said about the side effects. Actually, I was the one telling people that it can cause issues with retina. So there are also other treatments now. As you know, they are giving the plasma antibodies for some people who already had it. There is a doctor we know of, he is trying to get one. He is a cardiologist. He went to New York to visit his son. Now he's on a ventilator. And Prime Minister of England, last time I knew he was on ventilator this morning. I don't know how he is now, but
another thing back up for just a moment. So you take a person's blood that was tested positive, then retested, no longer has the virus, it's out of their system. You get their blood, you spin it in some preparation, you inject it in an infected patient because it has those antibodies to fight this. Is that how it works? Am I understanding it correctly?
That's correct. But again, if you really look at it, how many people survived with that? What is the effectiveness? We don't know. Like Trump says, what do you have to lose? That is the reason I'm a strong supporter of that. But there is another treatment too, though. We are working on it to get it approved right now.
Okay.
It is giving the umbilical cord stem cells, expanded umbilical cord stem cells. You need to have a lot of them, like 1.5 million per kg or so. We give that as infusion, IV infusion, and most of the time they may need only 1 dose. Sometimes they need 2 doses. So it is not available in the United States. It is illegal to expand the stem cells. But there are 3 companies which do these and send them abroad. So we are asked, one of the companies agreed to provide us with the samples. We need 64 patients to prove that whether it works or not. In China, they have very good results with it. People walked out of the ICU after.
So they're using umbilical cord stem cells in China right now and injecting it, infusing it into somebody's vein.
That's correct. Expanded umbilical cord, not just the regular ones. So they
And
don't
what do
have that many stem cells.
what does their research say? Are they saying it's working?
Yes, yes, that is where we found it. They did a first randomized controlled trial. They included only 7 patients in the treatment group and 3 patients in the control group. But results were so good, they went ahead and published it. There are 4 other control trials from China going on. In the United States, recently they approved some stem cells, not the expanded ones. They haven't done that well in one study, the rumor. But still, I'm very happy that they're letting them do it. Another 2 companies got the approval. But apart from this, they also have the exosomes available. Exosomes are derived from stem cells. They're even smaller than the stem cells. They are on the supernatant, the top layer of the stem cells, and they can be infused. Right now, they are available in the United States. They're not just approved for intravenous administration. So our goal is to get these 2 treatments approved by FDA.
So the exosomes, just so it sounded like you said the exosomes actually are legal to do right now. Is that?
Yes.
Okay, which is a stem cell from babies or from the
umbilical cord cell. Yes, all of them come. Most effective ones are the ones which come from umbilical cord. You can get the stem cells from the fat. You can get the stem cells from the bone, but for this purpose, these are the best ones.
Now help me understand, if you could dummy it down a little bit for the lay people that are watching this. How are stem cells fighting or helping your body fight this coronavirus?
They are helping your body in one way, but the most importantly, what they do is when coronavirus affects you, your own body's immune system kills the virus. In that process, all these immune systems, all the inflammatory substances are released. So they call it a cytokine storm, like a terrorist attacking you, or a storm is coming. So your body is full of these cytokines. That is the reason why you need run fever. And sometimes they even tell you in this thing, you don't want to get your fever down. Don't take Tylenol or anything to reduce the fever. Fever is protective.
Interesting.
So you have to modulate that immune system and remove the inflammatory substances. You need a very strong inflammatory substance. So these stem cells are the only ones which have the strongest inflammatory action. That is how they help it.
So now, look, I've interviewed doctors where you have to go to the Cayman Islands out of the country to get these infusions. Is that the same kind of infusion we're talking about today?
Yeah, that's correct, but I don't know what they are getting it for. Like exosomes, they do make anti-aging medicine you were talking about a few minutes ago. Many of them take it to make them look younger and improve their strength, and it does work like an anti-aging medicine. So, but that is not approved for that purpose any longer. At one time, when the government was not strict, they did it. Now they are under but constant supervision. So they have to obtain what is called an IND number for a new drug, for every new drug, investigational new drug number. Once they can use it for that specific purpose.
Okay, so you see a lot of promise then, both a combination of stem cells and possibly this hydroxychloroquine.
Yes, well, probably we're not going to use all of them, but as a first line of treatment, I would use hydroxychloroquine. If once a person has symptoms, it will reduce them significantly. I can't tell you, but one of my very, very good friends and pretty young wife and husband, both had problems, similar problems. They never got tested, but so tired and everything. And at that time, we went ahead and started them on hydroxychloroquine, and they improved in 2-3 days.
Okay, are there things you'd like to tell me, but you can't, being a medical doctor?
Yeah, there are a lot of things.
Okay. Are you able to give opinions, hunches, things like that? A couple of guys talking, like what we need to know.
Well, pretty much so far I have given is based on publications and my personal experience, but again, they are not randomized controlled trials. It will be very hard to get randomized controlled trials, and sometimes they produce borderline results. And it all depends on how you look at it. That's why they call it evidence is in the eyes of the reviewer, just like beauty is in the eyes of the beholder.
Okay, but there's
Same
enough
thing
of it out.
here, how we are looking at it. So we can take the same evidence, you and I, let us say we are on the opposite sides, like attorneys, defense attorney and plaintiff's attorney. We can come up with a totally different thing. And most important thing here is that I have no personal interest, except that I want to save some American lives. I have no personal interest either in the stem cells or exosomes.
Do you think Dr. Fauci is doing a pretty good job under the
He's doing a
circumstances?
great job. He's doing a great job. I really like him. I have known him for a long time. And
You know him?
well, not personally, but
You've known of him. Now let's switch over for a moment. Your specialty, you founded the specialty of interventional pain management. How are the people that are currently on pain meds, things like that, the pain patient, how are they at greater risk and what could they do? Let's switch gears for a moment.
yes, we were talking beforehand. It is a very high risk situation. First of all, chronic pain itself reduces your immunity. And all anti-inflammatory drugs you take over the counter, such as ibuprofen, Aleve, these things also reduce your immunity. A lot of these patients are on this for arthritis, etc. And then opioids, the pain
Can I
medication.
stop you for a moment?
Yes,
You just rattled off 3 over-the-counter drugs or, medications or things you could take. Are you recommending for people to stop taking those for their arthritis, for their, aches and pains right now?
That is what CDC is recommending.
So you recommend that. So what you're going to have to deal with a little bit of pain, but you don't. But it is taxing or it compromises your immune system.
That's correct.
So could you say
it
those
increases your prevalence of, increases your propensity to get coronavirus. So
can you tell me what those are one more time?
all the anti-inflammatory drugs over the counter, they are called either Aleve, that is the naproxen, or ibuprofen. And maybe I said wrong. Aleve, ibuprofen, that is also ibuprofen, right?
Okay.
And there is another one, naproxen. That is a long-acting one. Both, all 3 of them are over the counter. Just 2 drugs, but 3 different names.
And so that is definitely going to affect somebody's immune system.
Yes, we are doing all the phone visits and everything. I've been telling every patient not to take them. And there are people who are on prescription anti-inflammatory drugs like Celebrex, meloxicam, Relafin. All these drugs, I'm telling them to get off of them. I'm not giving them any longer.
What about these allergy medicines over the counter?
Allergy medicine, thus far they have not said anything about them. But on the same token, your pain medication causes the same thing in higher doses. In lower doses, you're okay with pain medicine, and you're okay with Tylenol. Tylenol does not have any anti-inflammatory effect at all. It is only analgesic effect. So it reduces the pain, but not reduce the fever. In opioids, pain medication like Narco, Percocet, morphine, Dilaudid, all these drugs, in high doses, they can reduce your immunity and increase your propensity to get corona. But they are somewhat safer actually than anti-inflammatory drugs at lower doses. But if you are taking very high doses, then that's also a major risk factor. Some of the drugs we use in injections, nerve blocks, steroids, they increase the inflammation. So people cannot have the treatments with injections. Whenever you do surgery, you can have more infections. Like first patient who was diagnosed with this disease in China had surgery. I think there were 14 or 16 people exposed to that, and all of them died. So people are taking it lightly and going and doing some surgeries. I would not recommend that personally.
So
myself.
any type of surgery is going to take away energy that could be used to fight the coronavirus, and now it's being used, your immune system is being used to repair itself.
That is your best case scenario where neither the surgeon nor the staff are infected. Nobody else in the waiting room was infected, and patient was not infected. If this happens, then your scenario comes. But if there was somebody infected in the whole circuit, you are going to be in trouble.
So what do you want now? You're doing telemedicine, virtual consults, things like that. What are the frequently asked questions you're getting from these patients that are in pain? What do they want to know?
Most of the patients are actually happy that we are not exposing them. They don't have to come to the office, and some of them love it. They just want this to be forever. The consults, I mean, not the situation. Because we call them at home and they talk to us, and it takes 15 minutes or so, it's done. Whereas some people come here to see me for drive 2 hours, wait in the office for another 1 hour, then talk to me about 15-20 minutes, and then they drive back 2 hours. So they're spending 5 hours of their time. Here, you don't need a driver, you're at home. So there are several things you can do with telemedicine. It has two components to it, video and audio. You have to look at the person, and you also talk to the person. But during this emergency, we went to Medicare and got it approved so that we can just do an audio. We don't even have to have a video. We can talk to them on the telephone, and they pay us just like a regular visit.
So
but that lasts only through,
So 70-year-old, 80-year-old, they're not tech savvy. They can just do it by audio call. So legally, is this just for, because look, you have, for people just tuning in, you have 13 locations all over Kentucky, big pain management center. Plus, you can't be a pain management physician, anesthesiologist, and not know who Dr. Manchikanti is, right? I think that's true for sure. But my question is, this is reimbursable. Is it only for new patients? Is this
No, definitely does not work for new patients. So the reason why we worked so hard on this is, first of all, we are not equipped personally ourselves. We are going through that, and we were finding a lot of difficulties with it. Then we found that majority of the patients, just like you said, in my practice, we have locations in Kentucky, Indiana, Tennessee, and Illinois. So I think about 40 to 50% of the patients, or 60%, do not have a video capability. Even though they relaxed all the things, like you can go on WhatsApp, you can go on a Facebook, you can Zoom. These were not permitted before. They were relaxed the HIPAA regulations and so many things. So we have been trying to get this, and then they said you can. That is what we lobbied for, and they said you can go ahead and use it, only telephone, and bill it as a regular visit. And that is what we have been doing. One of my friends, he's in St. Louis, actually, he found this problem that half of his patients don't even have phones. They have phones, but all their minutes are gone in first 5-10 days. They can't even talk. What they are doing is they're coming to and sitting in his parking lot. So he was going and visiting the patients in the parking lot. I just told him that don't do that. Then he said, what am I going to do? They are going to go to the emergency room. I just told him, buy 10 phones, leave them at the door. They will pick it up, go back to their car, and call you from there. After that, they put the phone back in there, and they go home. And we can only call the prescriptions by electronically. We cannot give paper prescriptions any longer. So that makes it a lot easier. You cannot call by phone if it is a controlled substance.
Okay, now, so I understand this correctly for people watching this. So you probably have 5,000, 10,000 or plus patients in your system. What if they haven't seen you in 13 months? Can they still do a virtual consult and still get an update on their prescription if they've seen you in person?
Yeah, they can. If that is, it is the definition is a established patient.
Okay.
Established patient means you are seeing them within 3-year period.
3 years. Okay.
Right. If you don't see a patient for 3 years, that patient becomes a new patient after that.
Now you worked on getting this passed. Is that right? These
Yeah,
reimbursements?
That's correct. So.
Okay. Now, for people, pain management, there's a lot of people in pain across this country, or a lot of people that want to see their doctor. Is this rolling out across the U.S. where insurance is going to reimburse doctors for getting on a video chat or getting on a Zoom call or getting on a telephone with a patient?
Actually, video call and audio call, it is universally accepted. There should not be any objection for that. For audio call, as of now, Blue Cross Blue Shield, Anthem, they have agreed to pay for that. According to President, Cigna and Aetna have agreed. All Medicare and Medicaid have agreed. Veterans Administration has agreed to pay for that, and TRICARE has agreed to pay that. So majority of our insurers are paying. Other day in one of our centers, a insurer, workers' comp insurer called and questioned. We referred them to the CMS regulation, and I have all the stuff, so I sent it to him. Haven't heard from any, but once in a while you may get some rejections, and like Department of Department of Workers' Compensation in California, what do they call them?
Okay.
But they agreed to pay for the telephone calls only. So.
So now medical doctors will watch this program, and the lay public. You have a website that is a resource for both the public and both for doctors. The ACEP is tell us the website to go to for that, and tell us a little bit about what they could find there.
Well, it is www.asipp.org. That is the website for American Society of Interventional Pain Physicians. We are also conducting many things. On this website, we have a column on COVID virus, corona, and then we have once a week or sometimes twice a week webinars, like next week, coming week, or this week, tomorrow and on Friday, we have 2 webinars educating the doctors and other providers how to survive this. We are also working on financial assistance from the government, like Payroll Protection Program, PPP. It passed in the CARES Act, which was the Stimulus Act. In that, you can go and apply for payroll. They pay you 2.5 times your 1 month's payroll. And if you maintain good payroll for 8 weeks after you get the money, that money can become a grant. You don't even have to pay that back.
So you're helping doctors, you're helping other medical doctors with this process.
Yes, right now, if we don't get any help, I would say 50% of the doctors will go out of business. It is very hard because we have to maintain all our employees. Like throughout our system, we have close to 275 employees.
Wow.
We have to pay for all these employees and survive. So we also have other opportunities where they can get the money. So you can get an advance from the Medicare, 3 months of collections. They will give you in advance, and then they will take it back. I also have another bill we are working to pass in the Congress right now. It was already introduced, but nobody is paying attention, and it was put to the side. Unfortunately, I don't know why, but it is a great bill, and it's a bipartisan. There are senators supporting on both sides. So we are trying to bring that bill back to life. In this bill, they actually give you the doctor's practices, any practice, 3 months of collections from last year. Then if you make same amount during these 3 months, then you have to give it back all. But let us say you borrowed $1 million, but you made only 100,000. So you pay them back only 100,000.
Okay.
There are many programs which can help you to sustain. My goal is, last night I was telling everyone in my task force meeting, they were saying that we are all doomed and nothing, but my goal is that if you survive 90 days, we'll be okay. We
And
have
when you
to
say we're all doomed, they're speaking in terms of, look, we can't pay our bills. These medical doctors across the country that have these
That's
large
correct.
teams like you do with 275 plus employees, they're panicking. Is that correct?
That's correct.
But
The
okay,
doctors are panicking because we may start cutting their salaries and other doctors in the groups. So, like, I don't even take a salary right now. My partner doesn't take one. So we have, but other doctors are worried about their salaries, and people who are looking for jobs, they don't get any offers any longer.
okay,
People who are going into training, they don't know what they're going to learn unless they're in internal medicine. They can learn everything about COVID, but they can't learn anything else. So medical profession is in a horrible shape. Like you could say economic recession or depression, the same thing in medicine. It is a healthcare recession or depression. It is not just related to the financial aspects, every other aspect. Now, my employees are worried about coming back to work, some of them. Some are coming, some are not coming. We are taking strict precautions. If somebody has any fever or any type of symptoms, we are quarantining them for 14 days.
okay. Now, let's just suppose the government gives you the reimbursement, helps you with your employee salaries. What do they all do? If you're not really taking on new patients, what are all these employees going to do? Are they going to work from home? Can and I also want to ask you this question, but can nurse practitioners, physicians assistants, who is allowed to do these telemedicine calls?
Whoever was supposed to, whoever had privileges before this happened, like normalians to see the patients in the office, they can all do it.
Okay, they can all.
There is no restriction on that. So.
And so with all of your employees, will they be, let's say that they are working from home. Do you have a lot of them working from home? Is there things that they can do that they can work from home? Or
there are many of them, then they can do that, like a transcriptionist can do that. Like ACIP employees, we have several ACIP employees. Only one of them is here.
Okay.
Two of them are there. One person can't stay home, and the other one, since nobody else is in the office, I'm not at risk. So my director of operations for ACIP, she comes in, and the receptionist, two of them come in. But rest of 14 employees or so, they are all working from home. And we have several transcriptionists. They are doing the same thing. Billing folks are coming. I gave opportunity to everyone. If they want to work, if they can work from home, if they want to, that's fine. But medical assistants, nurse practitioners, they do come.
Okay,
and they are working.
I want to end on a positive note. You must have some, because I know you have a sense of humor, and you're a pretty positive guy, because I've interviewed you here in our studio. Do you think we're 2 months away from maybe opening bars and restaurants? Because when that happens, I guess everything opens up. What are your thoughts on that? Not whether it's smart or not, or whether it's this. What do you think is going to happen?
I think the 2 months is a very good estimation. I think medical practices are going to open within a month now. From now on, we will start seeing the patients in our offices slowly and start doing the procedures, at least in some states. I think California is one of them, but California has different estimations. California's, if you look at it, entire United States is peaked. So it is at peak. So question is, when is it starting to going to start come down? I think it's going to happen in a week or two. Kentucky has peaked, it is coming down. So all these states which are in safe position can start. I don't think so for New York, Massachusetts, and New Jersey. Washington state will come down. They will start pretty soon. The reason being they started before other states. California and Washington states were 2 weeks ahead of New York, 1 week ahead of numerous other states, including Kentucky. So I'm really positive about it. Everybody is questioning me that, why don't you have burnout? Some of the lectures we are doing in this, our webinars is how to keep you going.
Okay.
No, preventing the burnout. I don't have any of those things. I'm doing good. I'm trying to help people. And I am positive that we will be fine. because
Okay.
government is interfering, and one of these bills I have in Congress is going to pass. We are working on those things, and I'm also very positive that stem cells and exosomes will be approved. So, as I was telling one of my friends, why are you doing all these things? Even if I can save one life, that is worth it for me.
Okay.
All the troubles you go through, that is worth it.
So do you see, last time I checked, I think it was yesterday, it was 8,900 people plus have tested positive, and then they're good now. They're well. They're not testing. They're free of it. What do you recommend for these people? Should they be giving blood, or should they be giving blood to centers that are packaging it for infusions specifically? Tell me about that.
That is highly questionable. I'm not a hematologist, and blood bank professionals will be able to tell, but I definitely recommend that if they had a proven corona, that means they will have plenty of antibodies in their system. If they are negative now, they should go ahead and donate blood for the antibodies.
So a blood bank, a regular blood bank, I know we have one here by us. My son likes to give blood. I'm about to do it. But if you tell them, hey, I tested positive for coronavirus 4 weeks ago, tested again, and I'm fine, will they even allow you to give blood?
I think it depends on if they are equipped to collect for antibodies, they would love you.
Okay.
And then, but if they are not equipped to do that, they will tell you where to go. I see so many ads, like one of my friends I was talking about, he was asking me how we can get him something done. Like Sanjay Gupta you were talking about, and he gave an ad on Facebook, LinkedIn, and everywhere asking for antibodies for this doctor who is a cardiologist. He's between 50 and 60, pretty young guy. He's in Ohio somewhere. So he's asking for blood for him. His picture, everything is on there. I don't know him personally, but I have heard of him, this doctor, because I go to Ohio many times to give lectures. I have friends there. So it is, until it affects you, Sanjay Gupta is one of them. He says that there is no evidence for hydroxychloroquine.
Yeah, okay.
The same way, there is not that much evidence, just to argue with him a point, that there is not that much evidence for antibodies, but when it affects you, yourself, your whole perspective changes. Like when my children, they came from, my son-in-law and daughter, they went to Mexico, they live in New York. I was so worried about them and asked them to come home. They won't listen, of course. But those things are extremely important. When it affects you, your perspective totally changes. Your evidence base completely changes. I had several patients over the years who said that doesn't work, and I was almost advocating voodoo medicine, but then they jump into it. When they had a problem, they came back to me.
Okay.
So personal is different. So.
Let me run this by you. My girlfriend's daughter is a speech pathologist in Austin, Texas. She was diagnosed with coronavirus. She has zero symptoms now at all, completely. In fact, she never even had symptoms. Not even a runny nose, fever, nothing. But because she was carrying it. Okay, so she quarantined herself. It's been more than now 14 days. She has a fiance. He is, and they're both 24, right? Around 24, 25. He has been around her, even though they tried to stay away from each other in their 1,000 or 1,500 square foot place. Guess what? He has zero symptoms and feels like he has nothing to worry about. I don't want to speak for him. Maybe he is worried about it. But this is good news. I said, look, when this is all over, we need to know that I guess one person in the household could have it and not infect everybody else. What are your thoughts on that?
That's correct. You can still take all those precautions and you may not get it. And sometimes you can take precautions and you may get it. It all depends on your viral load. How much virus you have in your system, how far you are, coughing phase. If you are coughing like that, very rarely it goes into somebody else. And initially, that is the reason why they recommended against the masks. They thought that that was the lowest level of protection was wearing a mask. But now they're recommending everybody wear a mask. So
Well, look, they're saying it's from droplets and things like that. So if you wore protective eye covers and a mask,
and don't shake hands.
and you don't shake hands, and you're in Costco, it seems like you might be pretty safe.
Oh, yes. Yeah, you are pretty safe with that. I would say 99.9% safe.
Now, I got to give a little tip here. I bet you haven't thought of this one. So, the sleep, because if you go online to Amazon, you can't find these masks anywhere. They're going to arrive in a month. I ordered some.
Oh, that's why what I'm doing is we are making cloth masks with my staff. We just had a meeting. We are going to make all these cloth masks and give one to every patient who comes in.
That would be very
nice. Donate to the places. So.
Yeah, because us lay people, we can't get these unless you're, but here's what I was going to say. I stumbled onto, the eye mask you sleep with, that they just cover your eyes.
Uh-huh.
These are available. I ordered yesterday, and they just go over your head, strap on, cover your nose. You could breathe just fine. They're like $2 to $5 a piece, and they're available on Amazon right now.
Oh, that is very good. Maybe, yeah, we have some in our surgery because we put them so nothing gets onto our face when we are doing operations. So maybe we should get, ours are a lot more expensive, of course, but these may be worthwhile to look into.
Well, as of right now, because I haven't heard anybody talk about it on the news, you can get them. And I got mine the next day. So I ordered them. Oh. I paid, I think, an extra $6 on Amazon, and I got them the next day. So they're...
I will go ahead and talk to my staff and see if we can order some.
Okay, good. Yeah, that's the tip of the day. Okay, so now my next thing, thousands, I don't know how many thousands of healthcare workers have tested positive coronavirus 2 weeks ago. Those people now have antibodies, the survivors. Do these people, is there talk of them now coming into the workforce now that they've developed a little bit of immunity?
Many of them have returned to work. I know some who have returned to work already.
But do you endorse that like these are the people maybe that could be repositioned in the hospital system to take care of the most severe cases and maybe put the people that haven't been infected maybe with other cases? I don't know.
Actually, these people are safer because they developed antibodies in them, but we have to make certain that they're really negative, not false negative. So they have to test negative twice.
Okay.
Okay,
go ahead.
If they test negative twice, the chances of them doing any harm is very minuscule. And they will be safer actually, and I bet many of them are giving blood.
Okay.
Because you see, they are sacrificing their lives. They are not quitting and going home. They want to come back. I have some nurses who really want to work, and some nurses are so scared. The same way with all the stuff. I understand all points of view. I don't have any problem. All my other doctors are telling me not even work because of my age. They think that I'm at high risk. They don't want nothing to happen to me. So.
Yeah, but you're dabbling in hydroxychloroquine. So you might have a little bit.
That will help, you see.
Now, look, you're Indian. You have a good sense of humor. Eastern, Western medicine. Can you give us some advice? Look, and you're a surgeon. I mean, you do surgeries on people. You know a thing or two about what affects the immune system. And you also probably know a thing or two, because look, you've written thick medical textbooks. I jokingly said to you, the world's most boring books. I tried to read like 20 pages. I didn't even know what the heck you were talking about. So you know a lot about immune systems. What can you tell us off-label that you believe people that feel pretty good, like I do right now, I'm knocking on wood, what herbs, are there anything we need to know in Eastern medicine that maybe we could be doing, that'll help boost our immune system naturally?
Many of the things you take for anti-aging medicine will help here. Taking vitamin C, not to the toxic levels, but vitamin C is not toxic at all. But you can take vitamin C and you can take melatonin. That has been shown to have a lot of anti-inflammatory effects. I was just reviewing a manuscript which is submitted for our journal about melatonin. This came from Brazil. One of the authors wrote from Brazil, and vitamins and multivitamins are important, and maintaining your weight is very important. If you have diabetes, getting under control, that is the most inflammation. Insulin resistance is the most inflammation it causes. So if you reduce the insulin resistance, increase the insulin sensitivity, it reduces the inflammation, makes you lose weight too, but that will help a lot of people in this condition.
If you stay away from sugar,
yes.
It's going to help your immune system. If you stay away from bread, it's going to help your immune system.
So you stay away from bread, pasta, potatoes, and you can eat some of the things. And in a pure low carb diet, they say that you have to be less than 25 grams of carbs per day. But in this system, I would say you can even have higher number. Even if you have 100 grams of carb in your diet, you are going to do better because it is going to improve your insulin sensitivity. If you can get it down to 25, that will be wonderful.
But there's lots of carbs in vegetables. I mean, you can have your carbs in form of vegetables rather than your carbs in bread.
That's what I'm doing. Actually, my wife I haven't eaten any meat at all in a whole month now. She makes all this vegetarian stuff, and cauliflower is the main thing, everything, almonds and cauliflower. So those are the two things I eat most now.
Are there any secret herbs we need to know about?
Not that I know.
What about garlic? What about garlic?
Garlic is good. In Indian thing, what is coming out of Indian news is that chai, tea, not the green tea, regular tea, is good for, it is a good anti-inflammatory. Garlic is good anti-inflammatory. And there are a lot of these things they put in curry, Indian curry, like curcumin, that is very good. Mustard is good for your immune system. So there are lots of these things they put in Indian curries, and if you go to Indian restaurants, they make all this colorful stuff. A lot of them are healthy for you.
You say in India there's like a low rate of this right now.
Right now it is extremely low. Even that
part of it is the chloroquine, you told me, in your opinion.
Are they what?
Part of the reason why India has low figures is because they've been taking this malaria drug for quite some time in their history.
Right. A lot of people are resistant to that. Like my hometown where I have a school, I run the school and so on and so forth. They're not even following this social distancing rules and everything. And literally it is impossible to do that for some Indians. They live in one room. 20% of the families with 4 or more people live in one room. 40% of them live in 2 rooms. So if you are looking at a house where you can have each individual bedroom and so on and so forth, that is only like 10, 15%. So even then, the rate is, initially I was so worried that like it will be just gone. India will be gone off of the map. But once we found this hydroxychloroquine, and then I started thinking, wow, this may be the solution for them. So all my old memories of distributing this drug to poor people in town and those things came back. So,
if you don't have insurance, is it an expensive drug? It's 5 days.
No. It is only like $4 or something. It is very inexpensive.
So it's only like a 5-day treatment. Is that correct?
Right.
But some people take it throughout the month.
Some people take it, but now in India, they are saying that you just take for 6 days.
Okay.
You're fine. You don't even need to take again. So,
wow.
Unless you have it. So, but it is a pretty safe drug and you can use it. And again, there is a rare chance of issues with it, but smaller doses, I have never seen one. And I have talked to infectious diseases of Indian origin, and they have never seen one. I talked to rheumatologists, we do some partnership with research studies and those things. He has never seen one. They give it quite a bit for rheumatoid arthritis and lupus.
And by the way, are there real stats on the lupus people that have been taking it for lupus that have low incidence of getting coronavirus?
Now, I don't think they had that much opportunity to look at people yet. You see, other day, Donna Briggs was saying, one of the doctors from White House, she was saying that at that point, this was probably 4 or 5 days ago or something, she said 660,000 tests done, they don't have results on them.
Okay. Look, I believe, Norman Cousins wrote a book, The Biology of Hope, and I believe we need hope at this time. And so
Yes.
a little placebo may go a long way. So if hydroxychloroquine you take for 5 days, they've been using it for years and years and years. Here you are, a world expert on this topic, and you're saying probably okay to take when indicated. And if you're sick, you have nothing to lose. It doesn't hurt your immune system. Only if you have a heart condition, or I guess there's one other thing you have
you have retinal detachment or issues with retina. Even then, again, it is a small dose and you're taking on for a short period of time. And I'm not worried to take it myself. And I gave it to my family members. And
all right,
every person who is over 60, I'm advising them if they want to take it. I gave it to my uncle the other day. So if they want it, they can take it. So.
Well, good for you. Anything, anticipating this interview, is there something you wanted to talk about that we haven't talked about? And if not, we're short on time. But
well, the only thing I wanted to emphasize is that even in these hard times, we should not lose hope, and we are still taking care of the patients. Patients don't have to worry that they won't get their medicine, they won't be cared for. We are keeping all the appointments. I recommend all the doctors do the same. And it is easy to get on the telephone and still get paid some amount. Like our revenues are dropping to like 20% of what they were before, but we can still do it. And we will accommodate all the new patients as soon as we open, and which I'm hoping it is the first week of May.
Okay, good. Dr. Manchikanti, thank you for coming on the program.
Thank you.
Have a great day.